Hello, everyone, and welcome to Johnny's Ambassadors Expert Webinar Series for Parents. I'm your host, Laura Stack, the founder and CEO of Johnny's Ambassadors, where we educate parents and teens about the dangers of today's high-potency marijuana on adolescent brain development, mental illness, and suicide. We have another incredible guest with us today, whom I will introduce in just a moment after I go over a few quick logistics. This session is being recorded. You will not be seen or heard during the session, and your comments and questions are anonymous, so please feel free to share those. Stacey has kindly provided 3 different handouts to go with her presentation today, including a PDF which has thumbnails of her slides if you would like to take notes or refer to that. They are in the handouts section of your GoToWebinar control panel. The question box today will be very important for you if you have a question you'd like to ask Stacey. She will give comments and speak with her slides for 45 minutes, after which time we will spend 15 minutes asking Stacey your questions. So don't wait until the end. As you think of them, please type them into the question box, and I will read them off in the order they were received at the end. So without any further ado, I would love to introduce Stacey Worthy Esquire, a principal at Sequel Health Law, PLLC, and counsel to AMED Alliance, a not-for-profit organization that works to protect and enhance the rights of healthcare consumers and practitioners. She frequently engages in educational and outreach activities with employers and HR professionals, including on the topic of safety and legal risks associated with marijuana in the workplace. Ms. Worthy is also the author of several scholarly articles, including most recently, Dazed and Confused, Making Sense of Employers' Risks from Mandated Coverage of Non-FDA-Approved Cannabis Products. Stacey, we are so honored to have you here with us today and thankful for you to being one of Johnny's ambassadors.
Thank you for having me, and I'm happy to get started. Let's start this presentation. So just a little bit about AMED Alliance. We are a nonprofit health policy organization that works to protect and enhance the rights of healthcare consumers and providers. And a preview for today's discussion. I will start with some definitions of key terms and background on various cannabis products. I'll discuss federal and state laws governing these products. I'll discuss legislative proposals to mandate health insurance and workers' comp coverage of cannabis. I'll provide some recommendations, and then I'll be here to answer any questions that you have. So let's start with definitions. So terminology such as marijuana, cannabis, THC, and cannabinoids, they're often used interchangeably, but they have very different legal and scientific meanings, as shown here. So cannabis includes products derived from the cannabis sativa plant, and that includes 540 chemical substances. THC is a substance primarily responsible for that altered effects on a person's mental state. Marijuana is cannabis products that contain a substantial amount of THC, so usually that's more, or legally that's more than 0.3% on a dry weight basis. Hemp is cannabis products that contain low concentrations of THC, so 0.03% or less on a dry weight basis. And then cannabinoids, any of the over 100 chemical constituents of hemp or marijuana, with THC and CBD being the 2 most common. And then CBD is the cannabinoid derived from hemp and marijuana, or the synthetic version. So I like to show this slide because, as you can see, and as I'm sure you know, cannabis-containing products are everywhere these days. So here we have some of the more original ones. We've got hemp toilet paper, CBD potato chips, CBD-infused sheets and yoga pants, THC toothpicks, CBD hand sanitizer and seltzer water. And then we have my personal favorite right there on the bottom. It's a jar labeled "contains medical cannabis," for those who prefer to take their medication, quote unquote, in the form of a pizza sauce, just in case you thought you've seen it all. But the million-dollar questions are they safe and are they legal? So let's start with safety. We've been seeing a trend of increased cannabis potency, as I'm sure a lot of you know, which is also correlating with the rise in emergency department visits. So according to a recent study in the early 90s, the average amount of THC in cannabis products was less than 4%. In 2018, it averaged more than 15%. That's a huge jump. The average potency in products available in some state cannabis dispensaries can be even higher. And some concentrated cannabis products like dabs or waxes may contain as much as 80% THC. These increases in potency also correlate with that rise in adverse events, including those emergency department visits. So that chart on the right there, that shows data from the Substance Abuse and Mental Health Services Administration, or SAMHSA, from April 1st, 2019 to March 15th of this year, of 2020. And you can see that it says marijuana was the second most common substance involved in substance-related emergency department visits, and that's more common than alcohol, heroin, and cocaine. So studies have shown that marijuana use is tied to several negative health consequences. 1 in 10 who use marijuana develop a marijuana use disorder, and that number jumps up to 1 in 6 if the use begins before the age of 18. The American Health Association has identified risk of heart attacks, stroke, and impaired health functioning from marijuana use, and use during pregnancy has been linked to problems such as attention, memory, problem-solving skills, and behavioral problems in children. In adolescence, marijuana use can result in a plethora of problems, as is illustrated on this image right here. And according to a study from the University of Colorado Hospital in Denver, marijuana-related emergency room visits tripled after state allowed recreational sales. 2 and 3 patients per day were presenting with severe vomiting, anxiety, and psychosis. So now I want to talk about CBD. First, I want to draw attention to the distinction between FDA-approved CBD products and non-FDA-approved products. The approved products had to go through rigorous clinical studies to prove safety and efficacy. They're required to meet uniform standards regarding quality, purity, and dosing. So I'm not talking about those FDA-approved medications in this presentation because all those standards are not the case for those non-FDA-approved CBD products. So many of the products that are not approved, they're not prescription, they've been found to contain higher than advertised levels of THC, harmful metals, toxins, and mold. And in fact, one study found that controlled substances in them, such as spice or K2, in one third of the CBD vape oils that they had tested. And according to a March 2008 North Carolina HHS alert, there was an increase in emergency department visits by people who reported vaping CBD oil. So during a 3-month period, there were more than 30 reports of individuals who were treated in the emergency departments across the state for serious symptoms, including altered mental status, hallucinations, seizures, loss of consciousness, and rapid heartbeat. And the FDA also strongly advises against the use of CBD while pregnant or breastfeeding due to potential serious risks. The U.S. Surgeon General also warned about negative effects to fetal brain development, risk of low birth weight, and increased risk for premature birth and potential stillbirth. Also, CBD and other cannabis products in the form of gummies and candies can be enticing to children. Yet, as you can see from this image right here with the label, that dose is for 1 gummy. So you can easily imagine a scenario where you have a children who gets his or her hands on a bottle like this and then eats the whole thing, which is how we end up with those high number of emergency department visits. So this slide highlights that dichotomy with CBD products. So they're often marketed as a cure-all for everything from headaches to cancer, but the research and science isn't there. And with a lack of appropriate regulation, as mentioned, these products often contain unsafe ingredients. So let's look at these headlines. You can see the first one claims that CBD could potentially be used to shrink lung cancer tumors. And then you look at the other ones and we see we have a headline about increased chances of lung damage from vaping CBD oils, as well as hospitalization. Here's some more data on CBD. As of September 30th, 2021, poison control centers have managed over 3,000 cases related to CBD this year alone. And you can see this number is higher than all of 2020, despite not accounting for the last 3 months of the year. So cases just keep rising with the product's popularity. Likewise, we have Delta-8 THC, which is also growing in popularity. And it's a compound similar to Delta-9. Like CBD, it can be derived from cannabis or hemp, and some refer to it as marijuana light. It supposedly produces less of an intoxicating effect than Delta-9, but more than CBD. So is Delta-9 harmful? It certainly can be. Many may not be able to distinguish between hemp-derived and cannabis-derived products. It's also very misleading to refer to Delta-8 as a hemp product in general, because hemp, by definition, is not supposed to be intoxicating. It can also cause harmful reactions if taken in high doses. FDA and CDC have both issued warnings about Delta-8 recently. So according to the FDA, between December 2020 and July 2021, poison control centers received 660 calls from people who had consumed Delta-8, many of whom were children. Dozens were hospitalized with symptoms such as lethargy, slurred speech, erratic heart rate, sedation, and even coma. And this first headline here is from 2 weeks ago in Cedartown, Georgia. There, the school administrators and parents had called the police because several middle school and high school students appeared intoxicated while at school. The children were incoherent and transported to the hospital. And agents had discovered that 3 nearby convenience stores were illegally selling gummies and vapes containing Delta-8. 11 people were arrested. And additionally, in Michigan this year, there were 2 cases of severe adverse reactions in children who had ingested their father's gummies, also purchased at a vape shop. The children had developed sedation, slow breathing, low blood pressure, slowed heart rate, and they also required admission to an intensive care unit. So now let's address whether these products are legal. And the answer is it depends. And it depends on several factors, including whether you're just looking to state law or versus federal law. It depends on if the product in question, is it FDA approved? Is it a food product? How much THC does it contain? We also need to look at the activity involved. Is it grown solely for research? Is it being manufactured and sold? Are therapeutic claims being made? So let's briefly go over some of the federal laws governing marijuana in general. So we have, first is the Controlled Substances Act, or the CSA. And under this federal law, most cannabis products and their derivatives are Schedule I substances, which is characterized by a high potential for abuse and currently no accepted medical use. Under the CSA, Schedule I substances are illegal to manufacture, distribute, dispense, possess, or use. And there have been several attempts to remove cannabis from Schedule I, but none of them have been successful thus far. Next, we have the Farm Bill. So you note I said that most cannabis products are illegal, and the exception here is hemp. In 2018, the Farm Bill removed hemp from the definition of marijuana. However, hemp and hemp-derived products, such as certain CBD products, must still be produced in compliance with the Farm Bill. And that means that they can contain no more than 0.3% THC on a dry weight basis. if a product contains a higher concentration than concentration of THC, then it is illegal even if it's marketed as hemp. And also, just to know, new development from last week, the United States Postal Service released a final rule banning the mailing of all vape products, including hemp. Next is the Federal Food, Drug, and Cosmetics Act, or the FDCA. So for purpose of our discussion today, this law is most applicable to CBD products, and in particular, those products marketed as food or dietary supplements containing CBD. They're illegal under this law, and that's because that's because the FDA approved a prescription drug containing CBD as its active ingredient before that Farm Bill passed. So this law prohibits food and drug products containing the same active ingredient as the prescription drug. So you can see here, FDA's position is very clearly laid out, and it says CBD food and supplement products are currently illegal. Let's now look at Delta 8. So under the Controlled Substances Act, just like with CBD, it depends on whether the product is considered hemp-derived or cannabis-derived. If it's cannabis-derived or an analog, it's illegal. And if it's hemp-derived, it may be legal under the federal CSA. However, it is explicitly banned or restricted in at least 18 states as of this month, and is under review in at least 4 more. The Texas Department of Health just announced last week that it was illegal. However, there is now a case pending before the court challenging that determination. And other states have also introduced legislation to ban or restrict it. So now let's briefly go over some state laws governing marijuana in general. So as you can see from this map here, this is actually from earlier this year, states have enacted a patchwork of laws. This should be no surprise. From a complete prohibition on marijuana use, permitted use if the product contains CBD and low concentrations of THC, permitted for medical purposes, decriminalized, and legalized. Just note here too, so you saw that some states obviously distinguish between recreational and medical marijuana, but what is the actual difference between medical marijuana and regular marijuana or recreational marijuana? And the answer is nothing. The products are the same. One just requires a provider to order it. Yet many providers do not have the knowledge to assess whether marijuana could be helpful or harmful. So a 2020 study showed that healthcare providers were ill-prepared to answer patients' questions about marijuana. The providers reported that they had low knowledge and comfort level on recommending marijuana for medical use, and most reported not receiving education on the scientific basis of marijuana or training in best clinical practices for medical marijuana authorizations. Additionally, while states typically require a bona fide doctor-patient relationship before a provider can recommend a patient for marijuana use, we're now starting to see these websites pop up. You can see the 2 screenshots here more frequently, and that they allow patients to obtain a medical marijuana card without any provider relationship established. These screenshots show that they boast certification in 15 minutes or less. They say money back guarantee. One site says everything should be this easy. Another says they provide a discount if you bring a friend. This is not a traditional physician-patient relationship, and therefore there is no guarantee that the patient will have any sort of medical supervision to prevent harm. With that, let's now talk about these new efforts to mandate coverage of marijuana products. So far, there have been 6 states that have introduced bills to mandate that various health plans or workers' compensation programs cover non-FDA-approved marijuana products. And these include, this is a chart here, Hawaii, Massachusetts, Maine, New Jersey, New York, and Wisconsin. You can see that the various plans intend to, you can see the types of the various plans that they intend to govern. And that includes private health insurance, HMOs, state employee health plans, Medicaid, managed care organizations, exchange plans, disability insurance policies, among others. Here is Maine's legislation, and you can see here that it says health plans must provide coverage for marijuana for medical use. So very, very basic language. It conveys exactly what it's trying to do. And while none of this legislation has passed yet, and so no mandate exists yet, currently state laws vary on whether it is permissible for workers' comp to reimburse for these marijuana products. States such as Connecticut, Minnesota, and New Jersey currently allow for coverage. Other states such as Arizona explicitly exempt workers' compensation or employers from being required to reimburse for marijuana. Ohio only allows for coverage of FDA-approved marijuana products. Florida and North Dakota prohibit reimbursement altogether. And others, such as Maine, deem coverage outright illegal based on case law, which I will discuss in a moment. State laws governing employer-sponsored plans in particular are likely preempted by ERISA, which is federal law. I'm not going to go into too much detail there because it's pretty in the weeds, but if you are interested in learning more, I recommend reading the publication, Dazed and Confused, Making Sense of Employers' Risk from Mandated Coverage of Non-FDA-Approved Cannabis Products, and that is one of the handouts. But let's talk about federal preemption and the CSA. So federal law preempts state law in the event that the federal and state law conflict. The CSA likely would not preempt state law that simply allows or permits reimbursement of marijuana. So that's some of those workers' comp issues that I just went over, because it's not required. It's not requiring an entity to violate the federal law. However, if the state imposes a mandate, then that law would be preempted. So the difference is whether it's permissive or whether it's a mandate. In Twin Rivers, Maine, a court ruled that the CSA preempted a workers' comp judge who ordered mandated coverage of marijuana. And the court ruled that covering the cost of injured workers' marijuana qualified as aiding and abetting unlawful possession and use of marijuana and placed the employer at risk for criminal liability. And then in the case of Daniel Wright, a Massachusetts court came to a very similar conclusion. Again, it determined that the CSA preempted an order compelling coverage. The court noted that unlike patients and providers covered by the Massachusetts medical marijuana law, insurers and employees would not be participating in the patient's use of a federally prescribed substance voluntarily. So the risk of federal prosecution for aiding and abetting in possession and distribution would be involuntarily imposed upon them. So just to note, there is a string of cases that found that the CSA and state law do not conflict. However, a lot of the logic that's used in those cases is flawed. And again, I recommend reading my article if you want more information about that. So let's now talk about the FDCA, the Food, Drug, and Cosmetic Act. State laws mandating coverage of most marijuana products also undermine the purpose and intent of the FDCA. So under the FDCA, drugs intended to be used for medical purposes must obtain FDA approval before they can be marketed or distributed in interstate commerce. And otherwise, they're considered to be unapproved new drugs or misbranded drugs, and they're illegal under the Food, Drug, and Cosmetics Act. From a public health perspective, unapproved new drugs create safety risks to patients because they have not been reviewed for safety, efficacy, or quality. Because these non-FDA approved marijuana products are not required to meet those safety and efficacy standards, they're more likely to be contaminated with undisclosed substances, which I mentioned earlier. There was a 2019 study that showed 70% of products tested were highly contaminated with heavy metals, and that includes lead and arsenic, herbicides, and pesticides. And there was a 2020 study from the FDA that showed 49% of CBD products tested contained higher than advertised concentrations of THC. State laws mandating coverage of marijuana would also create an incentive for people to buy products that are often deceptively marketed. For example, I gave the example earlier of the of CBD treating lung cancer. Sellers of CBD products have also made unsubstantiated therapeutic claims that the products can treat AIDS, Alzheimer's disease, autism, cancer, diabetes, heart disease, kidney disease, Parkinson's disease, and even COVID-19, but without any rigorous scientific data to back up those claims, and as I mentioned, in violation of the FDCA. And this has led the FDA and the FTC, the Federal Trade Commission, to engage in enforcement action. So, for example, a federal judge issued a permanent injunction against one company for selling what it was calling organic hemp seed oil to suppress the growth of cancer. And then we have the Drug-Free Workplace Act. So it should come to no surprise that marijuana products can result in an impairment in the workplace. If an employee is impaired while on the job, the employee may face liability, including loss of federal contracts under this Drug-Free Workplace Act. This law requires good faith efforts to be kept to keep a drug-free work environment. However, the employer may not be able to meet that requirement if it is forced to cover marijuana products. And the Act does not contain any exception for employers who might be bound by state law. Employers generally are permitted to adopt drug-free workplace policies and may fire an employee who is impaired while in the workplace. However, these coverage mandates could create problems enforcing those drug-free workplace policies. And if an employer conducts drug testing, it may be unclear whether the employee is currently using marijuana on or off the job. And some states have marijuana anti-discrimination laws that may protect employees from being fired if using marijuana off the job for medical purposes. Some courts have ruled in favor of the employees. It makes everything a little unclear. Next, we have OSHA. So state mandates could expose employers to liability under the Occupational Safety and Health Act. And this act imposes duty onto employers to offer a workplace free from recognized hazards that could cause death or serious physical harm to the employee. OSHA has strongly supported measures that contribute to a drug-free environment, especially those involving safety-sensitive duties like operating heavy machinery. And an employer may have a general duty under the Act to protect against hazards resulting from marijuana impairment, given that the risk for marijuana is generally recognized in these industries with safety-sensitive positions. Violations include civil penalties of up to $70,000 and imprisonment. Yet, as mentioned, state mandates can interfere with employers' ability to successfully implement drug-free workplace policies. So regarding workplace changes, employers have seen a negative impact on labor productivity and income and earning ability. Employees may have a higher turnover rate, more absenteeism, and illness if they're using marijuana. As mentioned, marijuana can result in workplace impairment, and in particular, it imposes a risk for those in these safety-sensitive jobs, as I mentioned, There was a study of postal workers, employees who tested positive for marijuana on pre-employment urine drug tests had 55% more industrial-related accidents, 85% more injuries, 75% greater absenteeism. Also, some employers have a zero tolerance policy. So if an employee does test positive for THC, they can face disciplinary actions or even lose their job. And some employees may use products such as CBD thinking that they are safe. However, urine drug testing for THC is very unreliable. So even some of the most complex types of testing equipment cannot distinguish between CBD or Delta-8 and THC. And some states do not. Some states do have. I mentioned that. So laws mandating coverage of marijuana are essentially incentivizing marijuana use, and yet consumers and employees can face legal troubles as a result. Many tests, as I mentioned, don't distinguish, and so we have this story, that first headline here. The MTA bus driver, this is an individual in New York who got his dream job, but he took hemp tea without realizing that it contained a high level of THC, and then he lost his job. He ended up suing the manufacturer of that tea maker, by the way. These are a couple more examples of legal troubles. So there's a potential for arrest in certain states where CBD is prohibited. So we have a great grandmother who was arrested in Disney World for possession of CBD oil. And then there were a few reported cases of parents losing custody. Some individuals lost their job, as I just mentioned, for testing positive for THC. And this is increasingly common in jobs governed by the Department of Transportation, which has a zero tolerance policy. So I want to end with some recommendations here. Mostly it's important to know the laws in your state, what's allowed, what's not. We want to encourage states not to cover these non-FDA approved marijuana products. If legislation is introduced in your state, we recommend contacting your state legislator and opposing it. We want to educate employees and the public in general on the risk of marijuana, and then also encourage employers to adopt clear impairment in the workplace policies to set expectations. So that concludes my presentation. I'm ready to open it up for some questions now.
Okay, wonderful. Thank you so much, Stacey. She has her contact information up there. We will be posting this recording also on the same link where you registered. So please share it with your friends and your family. I'm going to take your slides down here so that we can chat. We did get a few questions, so thank you for taking those questions. The first one had to do with driving. Someone is asking, I understand there is not a test currently available to measure impaired driving. How do these laws affect those who have to drive in the workplace?
Yeah, so the insurance mandate laws is what I'm assuming that they're referring to, because there's also DIY and DUI laws governing the use of THC. So yeah, that's tricky because the laws would mandate coverage of these marijuana products, but you have to go by what your employer allows and doesn't allow. So if your employer does not allow you to use marijuana in the workplace, you could get fired. Additionally, if the state does have a DUI law in place, then you still need to comply with that law. So if some of the laws are based on per se, if you look impaired, then you could violate the law. It really depends on the state, though, because the DUI laws vary from state to state.
So how is, like Amazon then getting away with, well, maybe that's the wrong way to say it, but isn't it a public safety issue if Amazon doesn't mandate any drug testing on its drivers? Isn't that basically giving them permission to drive Amazon trucks high, or am I misinterpreting that?
Yeah, I think your interpretation is correct. They are essentially giving permission to drive high, or they're not gonna penalize those employees. But that still doesn't mean that they have permission to violate the law. So if there is a state law, a DUI law, and I think all the states have DUI laws, and most of them do cover THC. And if you're violating that law, you can still get arrested. So even if your employer allows it, you still have to follow the law. And it's just a best practice to just for public health and safety to not drive while you're under the influence.
Well, I mean, it's also illegal to drive while you're drinking, but we know people are out on the road having had drinks. So is it just public beware? I mean, do we just avoid any Amazon trucks that we see on the chance that, hey, they could be stoned because their company doesn't care?
Yeah, I think it's awful policy that they put into place, and I think it makes sense to try and get them to change that policy. I know that I don't know what state they're headquartered in, but I think it would make sense to write to the legislators in that state, putting pressure or asking the legislators to put pressure on the company to revoke that policy.
Or at least in Colorado, Amazon truck drivers, or wherever it is that you are.
Yeah, exactly. Yeah, any state, write to your legislators, tell them you're upset by it, that you don't feel safe, because there's so many Amazon trucks on the road every day. And so,
every day.
Yeah, so they should change.
Just as someone might have a drink at lunch, free martini lunch, how do you know the Amazon driver isn't taking a break and getting high and then getting back in the truck and driving again?
Exactly.
You don't if there's no risk to them otherwise.
Absolutely.
All right, another question. Are there employers that you've seen that allow their employees to use marijuana while at work?
Well, Amazon.
Well, yes. But, specifically, I mean, it seems unheard of, but as more and more states legalize, this person's question, I think, will become an interesting one. If, take Colorado, it's legal and for medical, and I would say medical and recreational. What if an employer decided if you have a med card, you're allowed to smoke at work? How can you see something like that actually happening, and how would it impact your coworkers? I mean, they've done it in schools. The schools have been told that children have to be able to have their medical marijuana administered, and in some cases, the teens' drug dealers have shown up at school to say they are administering their medication. It's unbelievable that that could actually happen in our schools. Could it happen at workplaces also?
Oh, absolutely. I'm sure it could happen, especially in the states that allow medical marijuana and prohibit discrimination based on a medical need for medical marijuana. A lot of employers do have zero tolerance policies, but not all of them do. I'm sure a lot of them are worried about liability if the employee sues for discrimination. And I know there are quite a few lawsuits against employers because the employer did try to take action for an employee who tested positive for THC use. So yeah, absolutely. I think that employers could potentially
Which one of those in the law then, if Colorado allows medical marijuana and someone uses it and they're high and their workplace bans marijuana use and drug tests and someone tests positive, which one takes precedence?
Yeah, so it depends on the state. And so, yeah, so if the let me think this question through. If the employer, you're saying if the employer bans it,
but the state says it's legal to use medical and they're using for their medicine and test positive, can the employer still say, sorry, doesn't matter that it's legal here, you can't use it at work or in the workplace and fire them for testing positive?
Yeah, so most of those laws don't require the employer to allow the employee to use marijuana in the job. It says that they can use it on their own time, off work, off the premises, on their own free time. So it doesn't require them to allow employees to show up impaired. If they're showing up impaired and they're not allowed to do their job, in most instances, the employer is permitted to fire them or to take some kind of legal legal action against them, or just disciplinary action against them.
Disciplinary action.
Exactly.
I know several employers here in Colorado who drug test, and they say, I'm sorry it's allowed in Colorado, but it's not allowed if you're going to be employed here. And they drug test and do fire people for having a positive THC test. Do you see more litigation happening with conflicts in those two laws?
Yes, absolutely. And it's because usually if you're doing a drug test, you can't tell when the employee used the substance. So they might say, oh, but I did it on my own free time. I was not under the influence while I was at work. There's no way of knowing, And so
except that THC stays in your blood for 3 weeks. So if they just say you have to have a negative THC test, I wonder if that bar could be achieved.
Yeah, except it's possible that the court could rule that that's discrimination.
Interesting.
Yeah, so it's
this
really
is really going to open Pandora's box if this gets legalized federally, isn't it?
Yes, absolutely.
Or shifted to a Schedule 2 drug or Schedule 3 even.
Yeah.
Okay, the next question has to do with kids getting med cards. So we have a question in that. Someone was asking about the graphic that you showed. Was it New Jersey where they could just do it online and it was guaranteed? Yep. Could a child in Colorado get a med card from New Jersey legally, or is it only do you have to be a resident of that state?
You have to be a resident of that state.
Okay, good. Yeah, that's a relief. This person was like, oh my gosh, could my teen get online and legally get a medical marijuana card in another state? So the answer is no.
Yeah, what's crazy now is in Virginia, on the radio stations, we now have ads for companies like that are advertising. Call us and get your med card. It's so easy. It just takes a couple of minutes. You get your medical marijuana right away. And it's the regional radio stations are now playing that commercial regularly. So I'm sure kids are hearing that. They're in their car all the time, and it's crazy.
Well, in Colorado, it's a rite of passage when you're a senior in high school, when you turn 18, to go get your med card. Now, we have legislation in place that now makes that more difficult. You have to have 2 doctors, and they both have to certify you have a debilitating condition, but not requiring them to have any kind of relationship with the doctor. I'm stunned they can get it just like that without even having to check their medical records, their mental health records, which now is required in Colorado. So it seems that an uprising of angry parents whose 18-year-olds now are suddenly legally buying shatter and wax may be forthcoming. Have you heard of any class action suits on children who now the 18-year-olds go and sell it in high schools and middle schools to the younger children? Becoming psychotic. Do you ever see some massive action against the marijuana industry like we've seen in big tobacco?
There have been several lawsuits against some of the CBD manufacturers. Dealt more with whether the preemption issue, whether they're allowed to legally sell it on a federal level. But I don't think it was based on whether children or people were getting harmed by the products. I mean, I'm sure cases exist. I'm not familiar with them. And I know from one of the examples that I gave, there was criminal investigations into those convenience stores that were selling the products.
Well, yeah, and we have criminal doctors basically here in Colorado. They're known as our pot shop docs, right? That for a few $100 will sell you a med card to young people who don't have any medical conditions. And it seems that with all of the poisonings and psychosis and emergency room visits and everything that we're seeing here in Colorado, that someday there may be the THC, that comes into play, and being able to, especially the Colorado Department of Public Health and Environment, the physician is protected. We can't even find out who gave our kids this med card when they were perfectly healthy. And in my son's case, for example, dying by suicide and being able to sue for wrongful death is impossible. Because you can't tell who the physician is.
Absolutely.
A lot of interesting legal questions coming up, I imagine.
Yeah, absolutely.
One person actually near your area says that Delta 8 products were being sold in a convenience store like gummies. What are the rules about purchasing? So do they have to be 18? Or so, like, because it's being derived from hemp, and the CBD is actually being turned into Delta 8 in a very complex chemical process, and is itself psychoactive, Delta 8 THC derived from hemp. So do you then only have to be 18, or do the same tobacco rules follow with the requirement to be 21? With the shop that got in trouble, was it because they were selling to minors?
Yeah, and that's in Georgia, it's banned. Whereas in Virginia, it's not banned. But I don't know off the top of my head if there's any restrictions on age, if it's considered hemp derived versus cannabis derived. So I'm not sure, but happy to look into it.
Well, it seems like our government is asleep at the wheel, with all of the hemp that was produced and the CBD having an oversupply, and very clever chemists using a process chemically to turn CBD into this Delta 8, and now Delta 10, Delta 12 coming out, THCO, THCA. And I found some websites the other day that you can just lie about your age and online buy Delta 10, Delta 12, which are psychoactive. As well. Is there any restriction on these companies who are selling these CBD derived Delta products online?
Yeah, they're not allowed to sell them or mail them. That's not permitted. The U.S. Postal Service just came out and said that you're not allowed to do that.
Oh, good. So that shut down that business. If you could buy it online and get it in the mail, they can't do that anymore.
Yeah.
Nice.
Yeah.
I took some screenshots of that. I'm like, how are they getting away? All the kid has to do is lie about their age, and
that's not allowed.
Psychoactive products delivered right to their door. Crazy.
Yeah.
Good for the USPS. Finally, we can say yay. Well, that is the end of our questions, Stacey. Can you, would you mind if people have further questions? Can they reach out to you, and would you let them know the best way to get in touch?
Yes, absolutely. They can reach me at policy@aimedalliance.org, and I'd be happy to answer any questions that they have.
aimedalliance.org. Perfect. That's the website. Okay.
And I can also research answers to some of the questions that I didn't know off the top of my head. So feel free to send them to that email address.
Awesome. And so if anyone's listening to this recording and they have kind of a curiosity question about how a law or a policy may apply to their workers in their workplace, that's the type of work that you do. Can they reach out to you and just ask you some questions?
Yeah, absolutely. I'd be happy to answer.
Awesome. It's always really good to know what resources are available and where to go to for help. So thank you so much, Stacey, for honoring us with your time and giving us the gift of your talent and expertise. And most of all, thank you for being one of Johnny's ambassadors.
Thank you for having me.
Thanks. All right. Thanks, everyone. See you next time. Take care. Bye-bye.